Hello and welcome to the November safety meeting. We're going to be talking about ergonomics and musculoskeletal disorders. Before I get into the presentation, I wanted to go over a few of the incidents that we had since the last meeting in October. We did have one near miss that was reported to us. The team member was driving along the highway. There's construction going on and some of the debris was blowing into the roadway, so it was causing traffic to slow down. There was another driver that attempted to speed past everyone and failed. Always pay attention to your surroundings while driving. This is a great example of paying attention to what's going on around you and between you and the car in front of you, and also paying attention to who's driving behind you so that you can be prepared to avoid. For our incidents, we had two team members rear-end another vehicle. One team member was coming up to slow traffic and needed to get into the left turn lane and looked back to see if the lane was cleared. The team member came to a abrupt stop and didn't have enough time to stop completely and avoid the accident. Team member was turning right. The vehicle in front of them was also turning right and started inching forward, but did not complete the turn. Our team member started inching forward and was looking to see if cross traffic was clear and was unaware that the vehicle in front of them had stopped. We did have a team member that had a deer that darted out from the tree line in front of them, and we had a vehicle that was left at a site during a week-long project, and one of the nights the vehicle actually got broken into a few items. We had a DCP injury. The team member was moving location and slipped and tripped, and while they were tripping, the hammer started sliding and slid down and caught the underside of a team member's hand and broke their finger. And we had another slip. It was a team member on outside of the office. They were coming into the office, and there's some ice still on the sidewalk. They slipped on their side, had some discomfort in their ribs. Pretty painful incident. We have since made sure that the office has the salts out so that they can put that down in the icy conditions and make sure that we potentially avoid any other slips on the ice. And last one, we had a crew that was out to do some borings, and the gas line was marked, and they figured, okay, I'm going to move over, and was at a safe distance from the gas line, and ended up drilling through and breaking up a water line that was not properly marked. So did the right thing moving away from the gas line. Potential follow-up to make sure there's nothing else and it's clear to drill. So those were our incidents for the past month, or since the last monthly meeting. So for this month, we just talk about ergonomics and the musculoskeletal disorders. It's been since about 2017 that we've done this presentation, so we'll get into this one. What is ergonomics? Simply put, it's the study of work. Ultimately, the goal is to design a workplace so that it accommodates the variety of human capabilities and limitations to prevent musculoskeletal disorders. It's extremely important. Not only do the injuries potentially last a long period of time, but jobs are changing and there's an increase in production rates and advances in technology to be competitive. And as a result, our jobs today can involve increased specialization that requires the worker to perform one function or movement for a long period of time and day after day. May be required to work more than an 8-hour day, and there's a quicker pace of work to get as much done as possible. So there's a growing risk associated with ergonomics, one of the fastest growing categories of work-related illnesses. And according to the U.S. Bureau of Labor Statistics, ergonomic disorders account for 56 to 63% of illnesses that are reported to OSHA every year. A few different examples. We have repetitive stress injuries, repetitive motion injuries, musculoskeletal disorders, cumulative trauma disorders, and cumulative trauma injuries. And we'll talk a little bit more about each of these throughout the presentation. It's also a major injury that can occur within the office environment. So we like to think about this in the office. We use our keyboards every day. So if you take an employee that types 40 words per minute, that's equivalent to 12,000 keys per 8-hour day. It takes approximately 8 ounces of force to depress one key. So it takes almost 16 tons of force that will be exercised on your fingers each day. And if you increase that, on average, it takes workers 28 days to recover from carpal tunnel syndrome. A longer time may be needed to recover from amputation or fracture. We need to go through physical therapy and potentially adjust our work and make sure that we can function to the level we were at or close to the level we were at before the injury occurred. Taking appropriate rest breaks to just stop typing for a little bit will help relieve that stress on our fingers while conducting our work in the office. Getting into musculoskeletal disorders, these affect the human body's movement and the musculoskeletal system. They're often referred to as repetitive motion injuries, which is exactly what it says right there in the injury. It's a repetitive motion, repetitive movements. They can result from any activity that involves any kind of repetitive movement. So work-related activities, whether it's a repetitive job task, office-related task, lifting, or kneeling for long periods of time. Even some of our hobbies, knitting or sewing, playing a musical instrument, or gardening, can also have repetitive movements or kneeling for long periods of time, delicate movements repetitively with our fingers, hands. And then sports, there's tennis, golf, baseball, bowling, jogging. These are all repetitive movements or repetitive motions that can cause injuries if you're not properly rested, stretched, all those different things. They're fairly common among adults. You need to be paying attention if you have any discomfort in any of your joints because they can be serious or they can become serious. They can become permanent if you just let it go and leave it untreated. They can affect or change your lifestyle. You may not be able to do things that you previously have done for years. If you just let it go, you may lose the ability or the motion in your hands, wrists, arms, whatever it may be, and that will completely change your lifestyle. And it can be very costly to you. There's a lot of physical therapy involved, and it can be very costly to the company. On average, direct costs are about $20 billion a year, and total costs are estimated to be between $45 to $54 billion. This is because indirect costs can be up to 5 times direct costs. Indirect costs include things like training replacement employees, accident investigations, and lost productivity. Some different motions that can contribute to repetitive motion injuries. So lifting, whether it's stacking, loading objects or boxes, twisting, things like using a screwdriver, squeezing if you're using clippers, scissors, or other tools that require squeezing. Finger and hand movements, so pressing keys on a keyboard, pinching or gripping, pushing and pulling, using carts or racks to push or pull objects, can be a repetitive motion that causes some discomfort or an injury. Some other factors that increase the likelihood: constant repetition. If you're doing the same thing over and over and not getting enough rest, the tissue doesn't have enough time to recover from that stress, and then it breaks down even further, and that's where we get to tear and can cause major injury. Force. How much pressure is on the muscles? If you're doing constant exertion, how much extra pressure are you putting on your muscles without realizing it or without taking a break? Awkward posture. So while sitting or standing, you need to make sure you have proper posture. Crouching or walking, also making sure that you have the appropriate posture. You're walking on a level ground. These things can all increase the likelihood of a repetitive motion injury. And then lack of rest, even from minor impacts like typing. Taking enough time to take a break and rest. Also have increase in repetitive motion injuries from repeated impact from sharp or hard objects, vibration impacts, cold temperatures, and improperly designed tools, controls, or work areas. Always be paying attention to your tools. Check them prior to working each and every day. Make sure that they're not defective in any way, not damaged in any way. And if they are, you need to let us know, and we'll get you a new tool to make sure that you have the best tool in the best working condition to do your work. Pretty much any part of the body can be affected by a repetitive motion injury. So your upper and lower arms, your elbows, wrist, hands, and fingers, shoulders and neck, like your chest, abdomen, lower limbs, and back, and multiple other areas. There's 4 basic types. You have tendinitis, tenosynovitis, carpal tunnel syndrome, and circulation problems. So tendinitis is the inflammation of a cord that connects a muscle to a bone. So as you can see in this picture, you have the inflamed area on the tendon where the muscle is connected to the bone. And tenosynovitis is inflammation of the liquid-filled sheath that surrounds the tendon. So you can see here the inflamed tendon sheath along the tendon where the muscle is connecting to the bone. Some common symptoms you could have: you have numbness or tingling sensation, soreness, tenderness, dull, aching pain. You could have difficulty moving your fingers, shoulder, elbow, or wrists. Pain when lifting or exerting the injured body part. Your skin turns pale or cold. You could also have difficulty in eating, driving, and writing due to weakness in those areas. You always should be constantly aware of any soreness, tenderness, especially if you have numbness or tingling. Always pay attention to those things. Different treatments that you could do: restrict the motion of that injured body part, taking more rests throughout the day, take more breaks with that injured body part. You can use anti-inflammatory drugs. You can use heat or cold treatments, therapeutic exercise to relieve the stress on the injured part, or change in the job, tools, work area, or work routine. For carpal tunnel syndrome, you can splint your wrist at night or even while during your working hours. Ingestion or injection of corticosteroids, or work and lifestyle changes. So for severe cases of carpal tunnel syndrome, you may have to have surgery to release the transverse carpal ligament. It's the only permanent solution to help with severe cases. It's been an invasive procedure, and hopefully no one ever has to deal with that. And it can take some time, as mentioned earlier. It can take up to a month to recover from carpal tunnel syndrome. Ways to prevent perpetual motion injuries within the office is making sure that you're using our tools, the mouse, keyboard, in the proper way. Making sure that we have the correct posture while using our tools at our desk. So those are the mice, making sure that you're parallel to the table, centered, not holding your wrists in any awkward positions. Same with the keyboard, be directly in front of you, wrists parallel to the keyboard, and not having to be in an awkward position and put more force on our fingers while typing. Prevention can be simple and inexpensive. So we can increase work gradually in a new job, reduce your repetition. So if you notice that you're doing the same thing over and over, adjusting the job to make sure that you're taking more breaks or changing the job so there's less repetition. Sitting at your desk, adjusting the chair, your work surface, and the keyboard to make sure that it's all directly in front of you, and you're not too high or too low or straining in any way to use your keyboard, mouse, and look at the computer screen. For lifting, reduce the weight, use mechanical assistance, slide item instead of lifting. If you don't have to lift, avoid unnecessary lifting. Team lifting is extremely important. If it's too heavy, if it's an awkward object, ask for help. There's nothing wrong with asking for help to move something. It's better to do that than risk potentially injuring your back, legs, arms, whatever it is. And keep the object close to the body before lifting. Reduce awkward posture. Raise or tilt the work for better access. If you're working at ground level, try using a stool or bring the work up to your level while standing so that you're not crouching for too long, kneeling for too long. Alternate between bending, kneeling, sitting, and squatting if you do have to work low to the ground. Use elevated work platforms or rolling stairs to reach objects that are above your head. And always use the right tool for the job. Always make sure that you're using the tool the way it's supposed to be used, the way it's designed to be used, and make sure that you're always double checking to make sure that it's in good working condition. Some gripping risks. Make sure that you use light tools to reduce risk from forceful gripping. Suspend the tool with counterbalancers. Use long lever arms on tools. And use hand trucks, carts, or conveyors instead of carrying objects especially for longer distances. Risk from pinching. To reduce risk from pinching, change from a pinch grip to a power grip. So your pinch grip, shown here, is so the object is right in between your tip of your fingers and your thumb. Power grip is the full grip around the object, the handle, whatever it is on the box, so that you have a complete grip around whatever you're carrying. To reduce risk from hand or arm vibration impacts, you can use anti-vibration gloves. isolate the vibration from the user, and use low vibration tools. If you start to experience symptoms, early detection and care is extremely important. So if you're noticing any symptoms, notify Human Resources and the Safety Director promptly. Seek care from a qualified healthcare provider. And if the injury is a result of work activities, then workers' compensation insurance will cover the costs of diagnosis and treatment. Just have to make sure that you let us know. We need to get early care or care as soon as possible after you start noticing any symptoms of potential repetitive motion injury. Some exercises that you could do while at your desk to take breaks from constant typing. You can do the wrist extensor stretch. You gently apply pressure and bend the fingers and wrist downward and hold that for 10 seconds. So it looks like this. Pulling everything, stretching out the wrist and hand. You do motion wrist circles. So make a fist and turn the wrist in a clockwise circle 5 times, then repeat in a counterclockwise circle. So you can see in this picture here how to do that. And these are all easy to do just sitting at your desk. Take a quick break, stretch everything out. Fist flexion. Apply downward pressure for 5 to 10 seconds, then upward pressure on a loose fist. So it looks like this here. So it's kind of the same as the wrist. So good ergonomics is good economics. And safety matters every day. Thank you. If you have any questions, please send an email to Safety Help, myself, or Mark Holloway. Once you've completed the viewing the video, please sign-in sheet, return it to myself or Safety Help, or sign the communal safety sheets within your office. Thank you and have a safe day.